Good afternoon. My name is Dawn Haughton, and I'll be presenting this afternoon alongside my colleague Judith Mabelis. We both work at the School's Health and Wellbeing Improvement Research Network, which is based within the Health and Wellbeing Institute at the University of Glasgow. And so what I'm going to focus on just in the first part of this presentation is really the evolution of our engagements with the education sector over the last few years, just to really demonstrate the impact and influence of the network and its future potential. So 2.5 years ago, we set out to see whether schools would be interested to work with us to explore the potential of using health and wellbeing data in the school setting. Very much to drive improvements and planning in pupil wellbeing, with a particular focus on mental health. And obviously within the Scottish curriculum for excellence, there's a real focus on wellbeing for pupils. So initially the majority of interest in the network was from secondary schools, and for the first year, really, we were dominated by secondary schools, with 2/3 of members being secondary. But now, with nearly 300 schools in the network, we can see a change in the dynamic and real growth within primary schools as well, showing an interest in the world of research and how that integrates with the school experience. We've just had it confirmed that another 160 schools will be joining us in the next few weeks, and they'll be coming from one local authority in particular, which will take us up to 450 schools. And at that point, we're going to see another shift in the balance as we move to 2/3 primary schools and 1/3 secondary. So that shift really opens up opportunities for early intervention, and also we can focus on the well-documented and sometimes problematic transitional phase from primary to secondary school. So with this growth as well, it will take, the network membership will represent over 180,000 pupils at that point, which is great. So as we've grown, so our engagement model has evolved. We began obviously by inviting individual schools to join us, and we shared either a school level health and wellbeing data with them, or regional data from the health behaviour in school age children survey. But as the word spread amongst schools and amongst local authorities as to how this data was being used, then increasingly we came to the attention of local authorities who were interested in building a data set of health and wellbeing alongside their traditional attainment and attendance data sets. So with that in mind, we now have 7 local authority areas who targeted all their secondary schools to join SHINE and become members, and they are interested in looking at that data and supporting their schools to use that data. 2 of those local authorities have written SHINE membership into their strategic plan for the whole local authority for this year, and so full SHINE membership is required for all primary and secondary schools. And one key driver for this is the SHINE mental health survey, which Judith will speak about later. In addition to that, we're also, it's probably worth saying, we're across all 32 local authorities in Scotland and all 6 regional improvement collaboratives. And one of those improvement collaboratives has chosen to endorse SHINE as a resource to be used across its 5 local authorities. So again, that's very positive in terms of our reach and influence as a national network. In addition to that, Education Scotland has promoted SHINE as a resource within its national networks across Scotland, and we've spoken at various events invited by them. So just to have a brief look at the application of the health and health and wellbeing data in schools. We have a number of school case studies on our website with members talking about how they've used the data in their schools. And these include, at a senior leadership level, school improvement planning, very much with benchmarking and tracking and monitoring in mind. But also at the other end of the school community, harnessing pupil voice and enabling pupils to engage with the data as well. One key area of interest has been the PSE, the Personal and Social Health Education curriculum within schools, and using the health and wellbeing data to review and develop that to really fit the context of the school that they're working in. And beyond that, obviously, being able to share good practice across the network is of value to teachers in schools. So in terms of the initial data reports that we issued, we used the SHINE case studies to inform our next steps in supporting schools to use this data. So the case studies set out to evaluate the impact of the SHINE HBSC data reports, and we asked the schools how they'd used them and whether they could identify a clear use for this kind of data going forward. So we conducted the case studies in 4 local authorities across 4 secondary schools and 4 primary schools. It was a very positive engagement with enthusiastic feedback from both schools and local authorities, who particularly valued the research expertise from SHINE, and they found this to be a really clear benefit to schools. Looking at the quotes on the screen, you can see that the stakeholders valued the clarity and accessibility of the reports, noting how much data they're actually dealing with on a day-to-day basis, and therefore they found the layout very, very accessible. In sharing these reports as part of the case studies, we had positive interactions at all levels of the school community, with particular enthusiasm in the pupil focus groups, who were very pleased to see their voice translated into these very comprehensive reports. We also had positive response from senior leadership groups as well, who could identify clear planning, a clear use for planning in the improvement planning cycle. So the process facilitated questions and discussions with the schools as well about perceived barriers to usage, and those discussions improved understanding by schools of the sample size of the HBSC survey, and also the interpretation of the data related to the sample size. So this in turn led to a request by the schools to be able to survey the whole school community. They clearly identified mental health as a priority for focus, and in the SHINE HBSC reports, they liked the gender split in the data and the regional benchmarks, which supported their understanding of their school context and the well-being of their pupils. There was also particular appreciation of the directory of organisations who can help, and also the suggestion for a whole school approach to mobilise the whole school community on the health and wellbeing agenda. So SHINE as a network and an infrastructure has continued to strengthen its ability to share good practice and promote positive interactions between the world of health research and schools. So through our website, we've been able to share opportunities and resources as we generate them. And one of these very successful areas has been the SHINE webinar series. We've now delivered 5 webinars from expert academics on the topics of sleep, suicide and self-harm, attachment difficulties, creating an inclusive environment to support the well-being of pupils with additional support needs, and also mental health, stigma, discrimination, and seeking support. So the webinars very much facilitate an interaction between health researchers and schools. So we've also managed to bring people together at 2 conferences, one face-to-face pre-COVID and one virtually last autumn, which again supported that knowledge exchange between the 2 areas and the sharing of good practice. Also, SHINE has accepted 6 affiliated research projects, which we've been able to promote within the network. And these projects are reviewed just to ensure that they demonstrate a clear benefit to the schools. We're currently underway with the SCRAMS project, which stands for Sleep, Circadian Rhythms and Mental Health in Schools. And I think this is a real testament to the strength of the contacts and the trust within the network, that 10 schools wanted to participate and that all the 8 local authorities involved gave permission for involvement, even during this very challenging period of COVID with remote learning and obviously a very disrupted school year. So building on all of that work, most recently we've offered some part-time secondments to educationalists to come and work with us to develop elements of our work further in tandem with the schools. We haven't actually released the job advert yet, but we've already got 3 people who have contacted us and are interested about the forthcoming opportunities, which again I think just shows that the influence of SHINE and the interest for this collaboration between the world of health research and schools. So that's a brief introduction to how far we've come in the last few years, and I'm now going to hand over to Judith Mabelis, who will take you through the next few slides.
Yeah, if we can stop there, great. Okay, that's okay. I'm going to talk to you a little bit about the SHINE Online Pupil Mental Health Survey that we've developed. I'll tell you a little bit about what it measures, give you some very initial results from that survey, and also talk a little bit about how schools have been using this data. So as Dawn explained, this has very much been developed in response to schools. So schools telling us that they want more data and they're particularly interested in mental health. It's been developed as a flexible resource for schools. So we've put together obviously the survey itself and all the accompanying documentation, and it's really up to schools to decide if they want to participate and when. So it's really, the ball's really in their court to decide what to do. In return, they receive a school level report. This is very much similar to previous reports that we've done on the HBSC data, which were well received. So this report contains some background information on mental health in young people. It also has obviously the pupil data. This is presented in sort of straightforward figures and tables, usually broken down by year group and gender. This time round, in response to feedback from schools, we decided to provide a bit more information on the measures that we were using, sort of what they were measuring in particular, some guidelines on interpretation, and trying to choose measures where we had, for example, national data or measures with cut-offs, which would help them, which would aid interpretation. Again, in response to feedback, we developed challenge questions. This was because some schools were coming back to us saying that they were having, they weren't quite sure, so they had all this data, but they weren't quite sure where to begin with it. And so we developed some questions for them to be able to do that, and also a list of organisations for help. The whole process is automated, which means we're able to offer a pretty quick turnaround to schools. So schools can usually get a report within a few days, a week of letting us know that they've finished data collection. Can I have the next slide, please? Thanks. So what does the survey measure? It's really trying to take a broad approach, a broad view of mental health. So looking at these different aspects of mental health. So we have mental health problems, subjective well-being. So that's looking at happiness with sort of 11 different aspects of life. And that was selected so schools could maybe potentially identify which areas children were less happy in. We also have measures of positive mental health, which might not be mental health per se, but attributes or traits that we know are associated with better well-being. And again, these could be areas that schools could perhaps work on within the school context. And the survey also looks at other topics which we know are related to mental health such as sleep quality. Can I have the next slide, please? Thanks. This is just quickly an example figure that you'd see in the report. So this shows those who are at risk of depression. It shows secondary school pupils. So we have a breakdown by year group and gender. So the boys in dark blue and the girls in lighter blue. And the symbol there is data from the Health Behaviours in School Age Children Scotland study for 2018. Can I have the next slide, please? Thanks. So the survey response so far, so we'd originally wanted to launch in March last year, but obviously COVID hit, so we decided to delay it a little bit. And we first went into schools in mid-September, and up until the end of December, we'd had data from around over 6,500 pupils taking part from 49 schools, sort of more primary schools taking part than secondary, and from about 14 different local authorities. But about half of those schools are from the one local authority, so there's been much more take up in one particular local authority. I'm going to present a few of the very initial findings from this data set, but just with the caveat that it's obviously not a nationally representative sample, and obviously there might be reasons these schools that choose to take part might be different to those who choose not to take part. On some of the slides I have data from the HBSC survey. Again, this is just to kind of benchmark. It's not to say we can't really draw any conclusions about whether any differences are due to COVID or not. Can I have the next slide, please? Thanks. So this first slide shows low mood. It's for secondary school pupils, and as we can see, perhaps not unexpectedly, within this sample, the girls are more likely to be having low mood, and that there is a kind of, as they get older, they're more likely to be reporting this as well. And as you can see, there's a box in the corner. So although this figure shows by data by boy and girl, within the survey, we do ask them, the pupils themselves, how they describe their gender. So with the options of boy, girl, in another way, and prefer not to say. Across the whole secondary school sample, we have about 130 pupils who didn't provide their gender, so said either prefer not to say or in another way. So unfortunately, there's not really the numbers to do by year group, but I think it's quite interesting to look at how the results that they're reporting, because they are tending to report sort of slightly worse outcomes than other groups. And as we can see here, they've got 67% are saying that they have low mood. Can I have the next slide, please? Thanks. So we also asked within the survey about how often in the past 2 weeks they felt lonely, and this figure shows those that have felt lonely most of or all of the time. And again, this loneliness was an issue before COVID, and now within this we see that around nearly a quarter of all secondary school pupils are saying that they feel lonely most or all of the time. And again, we see this difference by gender, with the girls being more likely to report that. And equally, amongst those who haven't provided us with their gender, we see 37% of them are saying that they feel lonely most of or all of the time. Have the next slide, please. Thanks. Equally, we've asked about school pressure, and I thought this one was quite interesting, because this is showing those who feel a lot of pressure, again, in secondary school. And as we can see, again, we see this gender difference, with girls more likely to saying they feel a lot of pressure. And we do see, particularly high levels of pressure being reported by pupils, S4, S5, and within the S4 there in the middle, we can see sort of the HBSC average. And we're seeing here that it's quite a lot bigger than what we'd see in 2018. And again, it might just be a product of the sample, but equally it might be sort of an impact. It's an understandable impact of COVID that these pupils are feeling a lot more pressure within the system at the moment. Now, the next slide, please. And so we ask about happiness with different aspects of life, and this slide shows those that score it towards the lower end. So it's scored out of 10, so they're scoring it 4 and below. And this is for all secondary school pupils combined, because pretty much the top sort of 3 or 4 things that they were most likely to be unhappy with were sort of common across all age groups. And you see that, hopefully you can see it, you see that top bar there, appearance. Around 30% of young people said they were unhappy with their appearance. And we do see that across all age and genders. And this is quite interesting, because this is a scale that's used by the Children's Society in their Good Childhood Index. And this 30% is quite substantially higher than their last report in 2020, where they looked at around 15% of their sample was saying that. So it is quite, obviously it's a UK-wide sample, and it's sort of different, surveyed in a different way, but it's quite interesting to see it's quite high here amongst our sample here. Can I have the next slide, please? Thanks. And this is just showing this low happiness with appearance by age and the gender. And as we can see, it really was something that kind of like the most cited thing across all age groups. And again, particularly pronounced among girls as they got a bit older. And equally, it was high amongst those who didn't provide details of the gender. So around 58% of those said they weren't satisfied with their appearance. Can I have the next slide? So yeah, a lot of that data gives food for thought and maybe a bit more on the negative side. So I thought I'd just kind of reflect on some of the things that we'd heard from schools, what they told us that they'd done off the back of receiving a report with data similar to what we've seen. So we really do encourage schools to look and reflect on the data, what surprises them, do things confirm what they already know. Some of the schools that have had reports have told us that they've been discussing it, the data, sharing with others. And what I thought was quite nice as well was also celebrating the positives. So not just looking at, oh, this is bad, this is terrible, but also looking at what was good and what they could also build on in that respect. And a couple of the schools have already started to share some of this data with their pupils. And, it's really important to seek their insight. It's their data, it's their feelings. So to kind of find out why they feel that way and how to improve. So there's a nice example where one school picked up on the schoolwork pressure and sort of went to pupils and asked them, what's going on here? So the pupils could kind of explain some of the difficulties that were happening in the school and also came up with suggestions as to how that could work. So some of the pupils suggested that they could relax a bit, there could be ways to relax a bit more in break times and things like that. And equally, a lot of the schools, I think, have been quite concerned by this dissatisfaction that we see with appearance. So they've started to do some quite targeted information and work looking at body image and confidence. Thanks. Can I have the next slide, please? Is that not working? Okay, okay, great, thanks. And so the next steps, we're going to continue to offer this survey to schools. There's been a bit of a dip since sort of they've gone back to remote learning in January, but we do expect more schools to take part and to be able to offer the local authority level reports. We're going to equally continue to find out how schools are using their data, what bits they're finding useful and how we can support them in their use of data going forward. And obviously there's a lot of rich data that we have access to, so we can carry out further analysis, looking at sort of different aspects of mental health, how they relate to each other. And also I think it's interesting to pick up on, to look in a bit more depth at these young people that aren't giving us details about their gender to kind of find out a little bit more about what's going on there. And just my final slide is basically Dawn and I presented today, but there was a whole other team of people who work with us on this. So thank you.